Karnataka, some 9 years old or 9th class old kid, she delivered the baby in her school's toilet.
We have failed miserably as a society. In her eyes, we've completely failed. I don't think any of us can ever look in her eyes. After 30 years, pillal kante, you may have an unhealthy child,
Right.
because your egg quality is dropping.
Right.
Now, we see egg quality dropping even in a 20-year-old.
Oh.
IUI is nothing but intrauterine insemination. They're just trying to put the sperm closer to the egg. IVF means in vitro fertilization. So what I'm doing, I'm taking out the egg, I'm taking out the sperm, we mix it outside in a petri dish and then I put it back into the uterus.
What is the success rate in each of these processes?
See, textbook says,
What is your experience saying?
I've seen.
Yes. China is in the news recently. They came out with a robotic wombs. What do you think?
These are very sensational news, Pradeep, but
These days, couples feel intimacy has reduced. What do you think? What's your view on masturbation? If to have sex during period time? Give us the weirdest case in your experience.
there was one case where
Oh my god! Before we dive into the episode, a quick reminder, over 90% of our viewers haven't subscribed yet. If you find value to the conversations like this, hit the subscribe button and join the community. It helps us bring more powerful stories like this to you.
So, to all the viewers, I'd like to start off saying, Pradeep called me and he said, ma'am, I'm a very shy person. I may not be able to ask in depth. And this is a question he's telling a gynecologist, okay? So, let's see how much we can get out of him and get out of me in this episode. Okay, we have to, okay, viewers, he's a very shy person is what he told, and he came to a gynecologist and saying he's shy when he wants a podcast with a gynecologist. So, let's see how shy he is also. Okay.
The first question that hits on my head is, lot of people these days, right? Especially, my colleagues around, they prefer not to have child. People are opting for. You heard this term called ding.
Yeah.
Yeah,
Dinks,
two people dings, right? Two people earning,
Yes.
no child.
Double income, no kids.
Yeah.
Yeah.
We wanted to take your opinion on this. What do you think? Why is this happening?
So now coming to the topic that you were talking about, Pradeep, see, dinks is, something which is catching on. And I don't see anything wrong with it.
Right.
I went to a conference recently and some of my senior colleagues did mention like, we should not promote dinks. I said, who are we to promote or not promote?
Right.
It is a personal choice. If you don't want to have children, you won't have children.
Yeah.
I mean, I don't think we should tell people just because we want to stay, have a job and we want to have our income. I don't think it's right on our part to tell them, nay, you should have children, promote this culture of have children, get married. No, I don't think anyone has the right to tell anyone to have children.
Okay.
I think it's a personal choice and it's a couple's choice. And if they don't want to have children, they won't have children.
Right.
If they want to have children, they'll have children.
Right.
Because children come with a lot of responsibility. You have to be prepared for parenting. Like I also say that no couple is ever ready to be a parent. But if they want to go ahead with it, they should. And it has to be a couple's choice.
Right.
And if people want to opt for no children, they opt for no children.
Get it.
Who are you or I to suggest and say, you should do this? If they ask you for your advice, tell them, having children before a certain age makes sense because you should be alive and healthy to make sure you are parenting them well. Ye nahi ki you have a child at 50 and by the time they are 10, you're unable to give them, when they're in the teenage years, you're unable to spend as much time with them.
Right.
And it is a couple's choice.
Yeah.
And with today's lifestyle, if somebody is studying really hard, you have to listen to your parents and you have to listen to your kids and then you have to, say no to a certain lifestyle. When you want to say yes to a certain lifestyle, I think it's okay. It's a personal choice.
Yeah.
And I think we should all start normalizing a personal choice.
Yeah.
If somebody comes and says, I do not want to have children, we are no one to judge.
Get that.
You have to normalize that a person can have their own choice and you respect it. If somebody doesn't want to come somewhere, it's their personal choice. If some couples do not want to have children, it's their personal choice.
Fair enough.
And I think we should normalize it.
Get that.
If they want to have 10 children, they'll have 10 children. If they
Oh
want
my
to have
God.
one child, they'll have one child. If they don't want to have children, they won't have.
10 children in the current generation, I think is going to be a very, very difficult
No,
task.
not at all. Pradeep, now I know what you mean when you're shy. No, it's not a difficult job to have 10 children. Huh.
I'm a father. I have 2 kids at home,
Huh.
and
You
I
got
can't
to
even
2.
think of 10.
You got to 2, another 8 only, no?
Okay. Keeping jokes apart, the other question that I have, right?
Yeah.
Women these days want themselves to be financially free, or they have career aspiration. They want kids. They choose it slightly later in the career. How safe is it? Do you think it's right to have kids late in the career?
No one asks a man, when he wants to be independent financially, whether you want to have a child early, you want to have a child later. See, there are 2 ways of looking at this.
Right.
A husband does not have the uterus. The woman has the uterus. So it's like a biological clock ticking.
Right.
I don't think we should equate that with career. Okay? In today's world, I don't think we should ever say, is career stopping a woman from having a child? I think it's somewhere wrong. The woman is also somebody's child.
Right.
Okay.
Absolutely. Yeah.
If the woman, you have to think about your child also. So the woman's mother or father also should think about the woman's career. Just like I'm sure, we would have wanted, if they had a son, they would be like, no, but you have to reach a certain height in your career. The husband is reaching a height in the career. It is never only the woman who has to plan the child. It has to be the couple that has to plan the child,
Right.
always. And the career is both their careers. If the
Right.
woman also wants to be independent, the husband also wants to be independent,
Right.
career-wise.
Right.
It doesn't depend only on the woman.
Yeah.
It's a couple's choice to have children. I
Right.
always tell couples when they come, don't have a child because only you want to have. It is a couple's choice.
Right. Right.
And second, career-wise, if you want to go ahead in career, why should anyone stop you?
Yeah.
Periods will not stop a woman going to Olympics, no? She's
Correct.
still going to swim, no?
Correct.
She's still
Yeah.
going to go for India and win a medal.
Absolutely.
Career, if a woman wants to have a child, we have women, yeah, we can handle so much. We are
Right.
handling everything. I don't think we should glorify handling everything.
Right.
But see, back in the day, at least studies said, after 30 years, pillal kante, you may have an unhealthy child
Right.
because your egg quality is dropping.
Right.
Now, we see egg quality dropping even in a 20-year-old.
Oh.
Whether you have it at 20, we see so many patients coming with low quality eggs even at 20. We see abnormal children at 20. We see abnormal children at 40 also. Birth defects and all that. So right now, the way we are progressing with the kind of exposure everyone's having, the kind of fitness we are all into, healthier lifestyles, and we all are healthy.
Right.
You cannot say we are unhealthy. Our life expectancy has increased so much.
Right.
Mundu 50 ante, it was a great deal. Now
Yeah.
people are living till 80, 85. So obviously the quality has improved. Maybe the standard of living has come down, but the quality of life has improved. We have to give it to it.
Reason for this question again, right? Again, coming with this experience that I have, couple, when they decide they want kid, when they attempt say a couple of months and they realize it didn't succeed, they immediately run for fertility check.
Correct.
Now, the question was basis this point. Very soon they start, taking the stand ki yaar, maybe I'm not fertile and have to go check. And both the couples go and check.
Yes.
So, hence this question: how many months should they try and
Okay.
then take a decision that I should
Okay.
go for a fertility check.
The dictum is the textbook definition for infertility treatment. When to go, when is a couple infertile,
Right.
is 1 year of unprotected sex in the ovulation period. 1 year.
Okay.
Depends on the age of the couple also. Like if they've crossed 32, we say 6 months. Try for 6 months unprotected sex, intercourse. In the ovulation period, if you're having unprotected intercourse, timed intercourse, and still you're not getting pregnant for 1 year.
Yeah.
Okay. If it is below 32, 1 year.
Right.
Both. Okay.
Right.
If it is above 32, then everyone wants to have children a little faster. Then we say take 6 months time. Even then, if they're not getting pregnant, then we say let's start doing some tests.
Okay.
See, we have to understand that Indian women are very fertile. Indian men and women are, their pregnancy rates are very high. Fertility rates are very high. Okay, we are one of those countries where the fertility rates are high.
Okay.
We are not the one of those countries where our infertility rates are high. Our fertility rates are very high. So there is a good chance that probably they're not having sex in the timed period, which not many people know. So I always tell young couples, I tell all couples, try for 1 year unprotected sex. Tab bhi nahi hua. They come and tell me, ma'am, I've been trying for 2 months, I'm not getting pregnant. No.
Okay.
Wait, the only thing I will tell my patients or anybody planning a pregnancy, always get your thyroid test done. Women, thyroid test done, and also you have to get your ultrasound of the abdomen done to rule out any simple causes.
Understood.
Like polycystic ovaries, poor ovarian reserves, or thyroid issues, sugar, BP, these kind of things you should check. Okay. This I will ask everyone to check, even if they are planning a pregnancy or not.
Oh.
Men also.
Okay.
And maybe your alcohol intake for men and women, alcohol intake, your smoking, illicit drugs, all these have to be stopped if you're planning a healthy pregnancy.
Got it.
So 1 year, not getting pregnant, trying hard to get pregnant, not getting, you should go for a treatment.
So you mentioned about ovulation period, right?
Yes.
What is that right window, if I may ask?
Okay. If somebody is having a 28 to 30 day cycle, that is when the woman is getting. See, ovulation window is only for women, not for men. Okay. Right. So between the first day of the period to the next first day of the period, that is, let's assume we are having a gap of 30 days.
Okay.
So the middle 10 days low.
Yeah.
Okay, middle 8 days actually, but the middle 10 days. So first 10, last 10, middle 10. That is your 30. Middle 10 days, any one day the egg will release.
Okay.
It normally stays in the woman's body for 22 to 48 hours.
Okay.
So which 22 to 48 hours, we will not know. Okay.
Yeah.
So it's in that middle 10 days. So our time, if they have sexual activity, unprotected sex, and the sperm meets the egg when it's released in that 8 to 10 days, then chances of pregnancy are very high.
Got it.
And if you're not planning a pregnancy, it may not work. Sometimes the egg releases little late also.
Right. Yeah. Right. Fair point. So with this, I want to slightly move into the AI side of it, right?
Yeah.
A lot of advancement is happening on the technology side.
Yes.
It is believed that MIT study says cancer was detected, women's breast cancer was detected much before it even could give symptoms.
Correct.
To a doctor, and doctors were surprised. So what's happening on the gynecology side? Any idea if you can throw some light?
On the gynecology side, AI has helped a lot in diagnosis and screening.
Okay.
Like extremely early. See, you have to understand, it's computer based. Okay.
Yeah.
It's artificial intelligence.
Right.
It is humanly impossible for one person, a doctor, technician, anybody.
Yeah.
Okay. To store that kind of memory and to have it on the tip of your finger.
Right.
So with AI, what we've noticed is, how it helps us is, it gives you a diagnosis. Ante, ఇప్పుడు మనం I just assume I'm sending a patient to get a scan done.
Right.
It will do a scan and it will diagnose it for me.
Okay.
It will say there is something which probably human error we may not pick up.
Okay.
On an ultrasound based.
Yeah.
I would still, and then it will tell that there is one speck which I'm like a radiologist may think it's an artifact also.
Yeah.
Might not pick it up because it's a human eye. A computer precisions are much better.
Yeah.
Okay, this is the difference.
Right.
They may pick up certain things which could be right, which could be wrong. We can't wholly depend on that. So it can pick up something which a human naked eye cannot pick up.
Okay.
Because it's computer based.
Right.
Precisions are higher and it knows what to pick up, what not to pick up maybe. Sometimes it can give a false positive also, which can cause stress to the patient.
Oh.
Okay, lekapoina, it can show that it may be that ani.
Right.
Okay, which a doctor might say, no, it cannot be that because I'm going to go ahead and ask the patient certain symptoms unnaya and all that.
Right.
So AI has helped a lot in diagnosis, precision, and if you feed in the patient's history,
Right.
which sometimes we may not be able to remember that kind of history. You feed in the patient's history, it is going to help give a treatment protocol for that particular patient.
Oh.
Okay, it can help. I think it's come to that level also now. And so it's going to help us in diagnosis, in gynecology. It's going to help us with protocols.
Okay.
Like if I put in this many eggs only are there, this patient's ovarian reserve is less in infertility.
Right.
And I tell AI can give me, listen, with this kind of thing, these are the protocols, which 99% I may remember because of my experience, we may not remember.
Right.
But human error is possible. Here, human error is impossible with a computer.
Got that.
But the human touch will never be there with an AI.
That's true.
Yeah.
That's true.
Empathy may not be there with an AI,
Yeah.
which I think most patients require.
Yeah.
And but going forward, if people don't want empathy, which I feel is lacking among everybody, AI is the tool for them.
No, I think empathy is needed, and listening to you, what you're saying, for certain roles within the healthcare, right? In one of our podcasts where we spoke to Dr. Chaitanya, he mentioned these roles will get replaced. Speaking to you, I feel gynecology is a role which needs empathy, and it's going to be there.
I hope so. I hope people are, doctors have empathy towards patients, and as long as doctors don't think they are gods, I think we are all living in peace. As long as doctors don't think they are gods.
Right.
Yeah.
Right. I get it. Now we have IVF and IUI.
IUI. Yes.
IVF and IUI, right?
Yes.
Now let's help me understand what are these two.
Okay.
And then we'll come to AI technology in these.
Yes. IUI is nothing but intrauterine insemination.
Okay.
In this what they do is they're just trying to put the sperm closer to the egg.
Okay.
That's it.
Okay.
I am not pulling the egg out and mixing it outside, making the egg and sperm meet. The egg is right there. I'm not pulling the egg out from the human, from the lady at all. I'm just taking the sperm, washing it, taking the best sperms which can swim till the egg, and put it very close to the egg.
Okay.
This is IUI.
Okay.
It is done under general OP procedure.
Understood.
IVF means in vitro fertilization.
Okay.
In vivo ante inside. In vitro is outside. Okay. So what I'm doing, I'm taking out the egg from the mother, from the lady. I'm taking out the sperm from the husband. I mean the sperm, they'll give me the sperm. So we mix it outside in a petri dish.
Okay.
Wait for it to grow to an embryo. And then I put it back into the uterus.
Got it.
Okay. Because it's happening in a petri dish. It's called a test tube baby. That's why it's called test tube. Because the baby is formed in the petri dish. Instead of a test tube, we just use a petri dish.
Got it.
Hence, it's called a test tube baby.
Understood.
So that's how the term came.
Okay.
But it's called in vitro fertilization.
Okay. What is this in vivo?
In vivo ante lopala avtundi. Dananta kade avute in vivo. In vitro ante baita jaste.
Got it. Got it.
This is just for layman terms to understand.
IUI is basically
outside.
We release the
we
sperm.
Just take the sperm and put it near the egg. Ante. We are not removing the egg from the mother.
Okay.
The egg is there.
Okay.
It's waiting for the sperm.
Okay.
In certain cases, the sperms don't have enough push to run till the egg.
Right.
Atlantapudu, we give the push.
Got it.
Okay.
Got it. Got
like let's say the sperm count is bad.
Right.
But not so bad that they have to go for IVF. There are grades.
Right.
Okay.
Right.
In certain grades, we can do IUI and then they conceive.
Okay.
In certain grades, we don't do. We know this grade, even IUI may not work. Please go for IVF.
Yeah. What is the success rate in each of these processes?
See, textbook says 10 to 15%.
What is your experience saying?
I've seen 40% success.
40% success.
Yes.
Okay.
Yes.
Either of the IVF or IUI.
See, you can't compare the two.
Okay.
IUI is totally different. IVF is totally different.
Okay.
IUI is done in a totally different sector of people.
Ah.
Different set of people who don't have any other issues.
Right.
The mother doesn't have any issues. The egg is forming, everything is fine, the tubes are not blocked. IVF, normally we do it when the tubes are blocked.
Ah.
Because the sperm and egg cannot meet.
Achha.
You know? So we do that. Or if the sperm count is very low,
Okay.
where no matter how much we push, it's not going to go.
Okay.
Yeah.
Okay.
Or let's say almost nil sperms.
Hmm.
Even 2 to 3 sperms we get, we can go and mix it outside.
Understood. Understood. I'm assuming IVF is costlier than IUI.
Yes, it is.
Okay. Okay. Given the process itself is complex.
Yeah, this is, see, here we are not doing anything. See, you have to understand the test tubes, the petri dish, the certain temperatures we
Right.
use. And once they do it for one,
Okay.
embryologist, when they do it, they are sitting on that one embryo for almost, to get the egg and sperm to meet outside, and to do it with such precision.
Yeah.
It's another level of art
Understood.
and another level of skill. Okay,
Yeah.
people might think, oh, it's like a, like a video game. I've heard people say that,
Okay.
Ma'am, what is the big deal, ma'am? It's like a video game. I'm like, try doing it. Try doing it. Sit as an embryologist and try doing it.
Hmm.
Your whole aim is to get a sperm to meet an egg and make it survive.
Right.
It's not easy.
Yeah.
Each time they do it, they have to put it in a certain temperature. Temperatures upper niche also, it's gone.
Yeah.
Imagine if the embryologist has fever itself, that temperature which is coming out from the embryologist's body is going to kill the embryo.
Right,
How
right.
much they have to be careful,
Yeah.
how much an infertility specialist has to be careful when they're drawing the eggs from the mother. And the equipment they use is extremely delicate and biodegradable, can't hurt the patient, can't hurt the egg sperm. So imagine how expensive the equipment is going to be.
Understand.
So it is going to be a little more expensive.
In fact, there is this sperm's life also is again limited, right? It doesn't live for long.
Anything that's outside of the normal temperature will not survive.
Acha.
See, inside our body, our temperature is very different from outside of the body.
Yeah.
So imagine the temperatures that we are trying to maintain inside the body for the sperm and embryo to live. That's exactly the same temperature you're trying to make outside for everything to survive. So anything that comes out, you can't ejaculate somewhere outside and say, listen, this sperm is going to survive, so I'm going to use this sperm. You can't.
Okay.
Even when you give a sperm sample, they are given in biodegradable non-plastic bottles, and they have to be maintained at a certain temperature.
Acha.
That's why we always advise, and even when you're doing IUI or IVF, we want the patient, the couple, the partner to come that day and give us the sample. So we wash it immediately, we get the best sperms and use it.
Right. Now I understand possibly the reason of why too many centers are coming out. Fertility centers, in fact.
True. Everyone wants to have children very fast.
Yeah.
Which is not wrong again. I don't see any problem with that. As long as there are centers catering to people and they are able to get the best treatment, I think it's okay. If somebody decides one fine day, wakes up and says, I barely have time, I have just 1 year, I want to have a child, you let them try. If it doesn't happen, they use a service.
Right.
I think we take it too seriously.
And
but you can have it all, in this day and age when people used to say, at least back in the day, you can't make the cake and have it too. No, I think you can. You can, and I think you should. I think we are in that generation where we should want it all, and there's nothing wrong in wanting it all.
Right. Makes sense. Sense. Now, here with we spoke of IVF and IUI, right?
Correct.
Now, how is AI going to help here?
See, most important, precision.
Yeah.
Let's assume we have robots figuring out what is identifying a sperm, identifying an egg. I don't think they will be able to get it out of the body. Okay, because that AI has to, I don't think, at least now, I don't think there's enough technology, because anatomy, the person's body is unique. Each person is unique. So, vocal ki ovary in one space unte, for another person, it can be a little rotated. Okay. So, it may not be in the same exact space. So, an AI technology may not be able to do picking out the ovaries or not the ovaries, but the eggs from the ovaries.
Right.
But what I feel it can do is, it can do what an embryologist may do. It
Okay.
may, I'm not very sure of it,
Yeah.
but maybe it can with technology where the sperm and the egg are kept in a petri dish.
Sure.
It can maintain, if you're going to have the whole system, it may be able to do that, because precision is going to be extremely good with a tool, with a robo. Of course, the precision is going to be
Understood.
very good.
Yeah.
But anything touching the human body where you're going to insert something, maybe certain FNAC procedures can be picked up by AI, but diagnosis in
Okay.
this, like, okay, I put in the whole history, I give all the things. Maybe in an infertility treatment, it
Mhm.
can pick up a diagnosis for me, which I'm unable to pick up.
Right.
Without doing any tube blocking tests or something, maybe it can pick up with diagnosis saying that
Yeah.
so and so peg cells are not there, which we can't see with the naked eye at all.
Right.
Impossible.
Right.
Okay.
Right.
Maybe it will do that. And then protocols, like I said, if you feed in the whole history of the patient, like the
Mhm.
patient, every little tiny bit of history that AI asks for, it can give a better protocol probably.
Got it.
These treatments will work for you.
Right.
And then maybe we can, curtail a better dose for it.
How do you think this will help in treating, AI will help in treating any other sexually transmitted diseases?
Like I said, AI can pick up diagnosis.
Yeah.
Maybe if you feed in history and then you tell so-and-so color, odor and all that, which
Right.
already people do.
Okay.
They Google half the symptoms and come.
Yeah.
They come
yeah.
and tell us,
Right.
sometimes.
Instead of Google, now ChatGPT.
Yes. Oh no, I do have a friend who picked up his own, he got his own diagnosis, which
Okay.
I think he went to a few general physicians, and then eventually he was very excited and happy that he picked up his own diagnosis with ChatGPT and AI. So I guess it worked,
What was this case?
So he kept having body pains. He's going to kill me for saying this, but yeah, I'm not going to tell his name. But so he had a lot of body pains, and he called a couple of physicians. He met a few physicians. He said, I have body pains, I'm losing memory and all that.
Okay.
And then we took history, everything. We were like, do a B12 deficiency, maybe that, this, everything we did. But I think some doctors, whoever he went to, the physicians, we don't really look for B1 deficiency at all,
Ah.
So he Googled everything. He went on ChatGPT, he told, and then it said clearly, it's like B1 deficiency. Please do your B1 test. And he did it, and he came running to my house. He's like, ChatGPT, pick this up for me. I have a B1 deficiency.
Right.
So I was like, good, at least you know. So, it does help in diagnosis a lot. So he was at peace. For somebody who lost his peace and he was anxious for 2 months, not knowing what was going on. And, it can play havoc with your mental state if you're not very sure what's going on with your body and no one's able to come to a diagnosis. It can be a small thing.
Right.
B1 deficiency, you take B1 medication.
Right.
And you're set.
Got it.
You're set. At least
Right.
like when you don't know what's happening with you. So I felt that, his anxiety levels dropped immediately from before the diagnosis to after. He was so happy. He went and got his B1 test done. Again, the lab gave a report saying he had a B1 deficiency, and he knew his diagnosis. So he's like, I have my diagnosis myself. I didn't have to study medicine for this. I said, yeah, but ChatGPT studied medicine for you.
Got it.
Yeah.
So AI will definitely help patients on the diagnosis side, is what you mean?
Yes, definitely it helps. It's already doing it.
Yeah.
It's already doing it. But I would advise patients, put in the right symptoms. Don't exaggerate your symptoms. Sometimes you might say, I have severe itching, I have severe swelling. But
Right.
actually the swelling could be just grade 1.
Right.
Right. And you may not know how to grade it, because as doctors, we are taught a certain level of grading.
Right.
Right. So this may help even budding doctors.
Okay.
AI might help budding doctors who want to learn more. Definitely it helps even experienced doctors, because we are humans. We can only retain certain amount of knowledge, and we have to keep looking it up.
Got it.
And sometimes some extremely new updates don't even come to us. We might miss updates, but AI will come up with all these updates. I think every doctor has AI now in their OP rooms. We all look it up sometimes. We might forget. We are humans too,
Got it. Yeah.
and doctors don't get a second chance.
Yeah.
We don't. If a patient dies, it's over.
It's
You
over,
know,
yeah.
we don't get a second chance.
Right.
So we as doctors want to do everything. We want to do our best. So there's no harm in doctors using AI tools
Right.
to get the right diagnosis. Helps us with treatment. Sometimes we might just, you know, lack of sleep, we might forget the doses also, which helps us. You know,
Got
AI
it.
helps us. So
Right.
AI will really help in diagnosis and curtailing a certain protocol,
Yeah. Yeah.
working out a protocol for a certain type of treatments also.
Oh,
Yeah.
example?
Like
you
for
can-
example, say somebody comes to me and says, you know, so and so infertility issues I'm having.
Hmm.
I have this, I have that. My husband has this. He has a history of family saying certain. I might not know exactly what protocols to give because there are hundreds of protocols.
Yeah.
I might not be able to remember all the protocols.
Right.
I just type it into AI and it might help me give the protocols.
Hmm.
But my job will be, I can't just because AI just gives me a protocol. It's my job to test, do a test dose on the patient, which
Yeah.
maybe an AI may not be able to do.
Get
You
that.
know,
Get that.
I have
yeah.
to test, give, like the AI might say, for example, say you come up to me and say, you checked AI and it told you you have anemia. And for your hemoglobin level, you need to get iron injections. AI will say, go get iron injection.
Yeah.
Okay. AI will not tell you, no, it will not come and do a test dose.
Right. Right.
Always, any injections, we always give a test dose.
Got it.
And will AI be able to pick up a reaction? Maybe, maybe not, unless
Okay.
I have enough time to put the pictures into AI.
Right.
So AI will help a lot with diagnosis, help you curtail a proper, you know, personalized treatment
Understood.
for a
Yeah,
patient,
yeah.
which most doctors do also, but it will
Okay.
give you a better treatment probably because of the kind of knowledge is, because of, not, I won't say knowledge, because of the kind of information that AI is holding.
Right. It kept reading everything across. So
Everything,
I'm
no?
sure it
Everything is
has a lot of-
connected. Yeah. It probably has information of your messages also, what you must have sent from your phone to somebody.
this is scary.
Yeah, it is. But it's okay. Open book.
Right.
What's the big deal?
Yeah,
Yeah.
makes sense. Now, with this conversation, I want to bring in what China is doing.
Yeah.
China is in the news recently. They came out with a robotic wombs, right? Or robot basically giving a birth to the child, or something like that, right? What do you think?
See, these are very sensational news, Pradeep, but there is no publicly, no forums, none of us doctors, anywhere, even in China. I
Okay.
have a few friends there. We've asked them. They said there is nothing in the news. It's just some rumor, sensation, nothing publicly, openly declared.
Okay.
Because if it was, it would definitely be in every forum possible.
Ah,
Is it possible to have a robotic womb? Theoretically, yes. For me to imagine, yes.
right.
If we are able to do a IVF outside and
Petri dish.
yeah, in a petri dish, I think anything is possible. But would it be liable? I mean, I don't know. It you know, like how they said, you know, somebody transplanted a brain, one person's brain into the other, was a sensational news, which happened about 15 years back. Till today, there's no news about it. So I don't know. Theoretically, yes, it could be possible, but I'm not very sure if that is your future, because
Okay.
women will still have ovaries, we will still have uteruses and uterus, sorry. And we will still want to give birth. Most women will want to give birth.
Right.
And if you want to give birth, I think we can.
Right.
You know, like they say, necessity is the mother of invention.
Yeah.
Yeah. I don't think there's a necessity right now for it.
get
Unless
it.
somebody is trying to get some designer babies or some soldiers or something to take on the world. It's a very Batman kind of a movie where they're trying to make something out of, you know,
Right.
unless they have some plans like that.
Got it.
I
Got
hope I don't get into trouble for saying things like that.
Right.
Yeah.
So, Dr. Priti, let's move to the next segment
Yeah.
where we speak about the core of yours, sexual wellness, for which patients come to you, right?
Right.
Right. So, these days, a lot of couples, right? Again, couples feel intimacy has reduced either because of work stress or because of some other stress.
Mm.
What do you think? Is this the only reason, or there could be something else? And why?
See, I truly believe what happens between a couple, only the couple will know.
Right.
From outside, it's very easy for somebody to say that, listen, y'all are not having sex. The intimacy is gone because of your work. I don't think normally intimacy will go because of work. Intimacy may go for other reasons.
Okay.
Which a couple has to work it out. They have to work it out. They have to talk. But yes, we do have couples who come to us and say, we want children. And then we ask them questions like, how many times a week do you have sex?
Right.
They sometimes say once a month, once in 2 months. In that case, we have to counsel them and tell them, boss, once a week also, you may not get pregnant. At least 3 times a week, chances of pregnancy are much higher.
Right.
And no matter how much we counsel a couple, I tell this to all couples, it has to work from both sides.
Right.
Both the partners have to work on it together.
Got it.
I have tried 10 days back. He said no. So now he's trying. It's not working. No, it doesn't work like that. Intimacy goes, I don't think because of work. I don't think because of anything else. I think intimacy goes because each couple has a unique reason for lack of intimacy.
Okay.
So I advise couples to sit, communicate, talk it out. It is never what you feel it is.
Yeah.
As a third person.
Okay.
I might say, oh, you both are working so hard. Where are you getting the time? You will always find time to have intimacy. You'll have time for sexual act. 5 minutes also you can have, which could be a great 5 minutes for some couples,
Right.
And it has to be something the couple has to figure out why it's lacking. And the couples always know.
Okay.
A couple will always know what is happening. So we advise them to talk to each other, communicate. And if they are still not able to communicate, that is when we step in.
Achha.
We communicate on their behalf with each other if they are unable to talk to each other.
Got it.
But intimacy, like everybody thinks, it's not because of work.
Right.
Never because of work. If somebody is saying it's because of work, you still have time to shower, na? Huh? You still have time to brush your teeth, no? Right. You will make time for sex also.
Understood.
Yeah.
Give us a weirdest case in your experience where you have solved this kind of a problem for a couple.
Really, I wish I could discuss, but I'm not allowed to discuss those kind of things. But I will tell you, there has no case is weird.
Okay.
And no case has ever shocked me.
Okay.
Because we all are willing, at least me and my team are willing to openly accept. We are non-judgmental. We are not here to say, this is so weird. How could you do this? How could you not do this? Nothing like that.
Okay.
What may be weird for you may be so normal for another couple. It can be very normal for another couple. Like some couples may come and say, we have sex only once in a year or twice in a year.
Oh my God.
That may be so normal for both. For the husband and wife or the partner. It may be so normal, but they can be best of friends. They can have romantic feelings for each other. They can be so happy and loving, but like we're just so asexual. Right. But we just love each other so much. And then there might be an absolutely different couple who's having sexual act every single day or every other day. But then you see that they're not at all best friends,
Right.
So nothing is weird, and
right.
But coming to there was one case where I think maybe they were not told, or they were not educated about sex. And I chalked down a protocol for the wife, and I looked at the couple and I said, EVV తీసుకోవాలి. They were a non-English speaking couple. They were only Telugu. I said, ఇవి తీసుకోవాలండి, ఇద్దరు వినండి, ఇవి తీసుకోవాలి. And I looked at the husband and I'm writing it for the woman. I said, తీసుకోవాలి ఇవి. I'm telling her, ఈ injections తీసుకోవాలి, అర్థం అవుతుంది కదా, తీసుకోవాలి. And then they come back. And I was so sure, the protocol was so good. I was so sure she is definitely going to get pregnant, It is such a simple case. And she comes back after the whole protocol is followed, the injectables, everything is done. They were like, మా ఇంటి దగ్గరే తీసుకోవచ్చు, ఎక్కడికి వచ్చేది. I said, మీ ఇంటి దగ్గర కూడా తీసుకోవచ్చు. They came to me and then I'm like, ఏంటమ్మా తీసుకున్నారా injections? How come you got your period? I expected her to be pregnant. And ఏంటమ్మా తీసుకున్నారా injections అంటే, ఎవరు తీసుకోవాలి మేడం? మీరే కదమ్మా, మీరే తీసుకోవాలి, మీలోనే ప్రాబ్లం ఉంది కదా, ఇంజెక్షన్స్ మీరే వేసుకోవాలి కదా, నేను చెప్పాను కదా మందులు వేసుకోవాలి అని. హీ లుక్స్ అట్ మీ అండ్ హీ సేస్, మేడం నేను అదే చెప్పాను, తనంతా నాకే ఇచ్చింది మేడం, మీరు నన్ను చూసి చెప్పారని నాకే ఇచ్చింది మేడం. That's when I realized my communication was so bad with that patient. You know, it was 1 in 100 patients, but that one patient, that couple taught me that no, look at them and tell only them. Because I was under the impression that I have to talk to the couple. You know, this was very early in my career, not now, very early. And I was so sure, you know, I came back from my infertility course, fellowship, and I was like, this is going to work, you know. And I'm telling, and, you know, I was taught, talk to the couple, talk to the couple. So I'm looking at the two of them. Now I don't even look at the person I'm not giving treatment to. I'm like, ఇది మీకోసమే, మీకు అర్థమైందా, మీకోసమే.
This is for you.
Yes, not for your husband. So she kept taking, and luckily, and then we did some tests for him. He had no side effects. All his complaint was, నన్ను తెగ పొడిచేశారు మేడం, ఆ ఇంజెక్షన్స్ ఎంత నొప్పేసాయి. సార్, నౌ యు నో వాట్ యువర్ వైఫ్ ఇస్ గోయింగ్ త్రూ. And then we gave the same treatment to her the next month.
Right.
And then she conceived. So
got it.
Yeah.
Got it.
Well, she came to my OP the other day to talk about something else. So I'm very happy. So now when you
Right.
said, suddenly I remembered that. Yeah.
Very, very, as in experience.
Yeah, now, yes.
So on the intimacy side again, right? People have these hormonal issues.
Yeah.
Will that also be a reason for reduced intimacy?
Yes, absolutely. See, we have to accept that men and women both have issues. Let's not just say it's always the women.
Okay.
Men also have their stress days. Men also have their cortisols high. Women also have their... Women have a phase.
Right.
You know, sometimes women's hormonal issues are over the roof.
Okay.
That time I tell patients, you know, when they come and say, she's having, you know, the ladies say, I'm just losing my temper and all. I said, it's okay. It is for everybody else to handle it, you know. But let's not just say only women have hormonal issues. Men too have hormonal issues.
Okay.
And this is something we have to accept. Maybe women, the rate is higher.
Right.
The number of women experiencing hormonal issues are much higher. Yes, there will be days where women don't even want to be touched. You know, that is called overstimulated. You know,
Okay.
There will be days, I'm sure you're living with your wife. I'm sure you know, there are days where you're like, dude, I'm not even going to go close to her. She may give me a kick or something. There are days. And some women accept it. Some women calm down. Some women just go into a shell. And some women just burst out.
Okay.
Each woman is different. And each body is unique.
Yeah.
You cannot say, my mom never did this. Why are you doing? Because they're two different people. Men have to accept that. And women also have to accept that men do have hormonal issues. It may be a different type of hormone. It may be a different chemical reaction going on in their head. They have it too.
Okay.
Okay. So during hormonal, if you're communicating really well, and both are having issues hormonally, I'm not saying they have some major fights or something. I'm talking hormonally, if they're not in sync. When a couple communicates, then they communicate well enough to come to a standard constant, a baseline. You know, some may be there, some may be there, and then you communicate. So communication is key. And like I'll always say, what happens between a couple, only the couple knows.
Right.
So they will figure it out if you give them the space. And both the husband and wife or the partners should want to do it together. You know, they want to work it out together.
Right.
It's not like I tried for 4 years, now it's his turn to try. It doesn't work like that, you know. Both have to want to try at the same time.
Right.
You know, and please, we should normalize that men have issues too. Men have oxytocin release too. Men have high cortisol levels too. We have to understand that not all men at all times are ready for sexual activity.
Right.
It is for both. It is in the head.
So it is common.
It is common, and
very,
we
very
have
general.
to normalize it.
Okay.
We cannot say men are always ready for sex. No, we shouldn't do that. It's very wrong. They are humans too.
What could be the issue in men?
Anything. See, you might have a lot on your head, just like how women have a lot on their head,
Right.
and they're not ready to be touched. Most of men do not. Maybe they're not ready. I won't say they would not want even touch, but I would say that when cortisol levels are high, stress levels at work, we have to think everything.
Yeah.
Certain times they just don't want it. Just
Okay.
like women, men also don't want it.
Hmm.
And that is something we all need to accept.
Okay.
It could be a cortisol level, it could be high blood pressure, it could be diabetes, it could be anything. Yeah, we have to accept some things.
Understood.
Yeah.
You mentioned diabetes. Obesity is also one of the reasons which we keep hearing, right?
Yes.
What's your take on this?
See, obesity rates have been drastically increasing.
Yeah.
They have been scarily actually increasing.
Hmm.
One of the main reasons for high cesarean rates also in women. Yes.
Okay.
Yes. Obesity is one of the highest causes for cesareans in Telangana right now. We have to really address it, obesity rates. And easy access to unhealthy food. Unhealthy food is cheaper than healthier food. And you get, I'm not saying don't eat fast food, these youngsters, I'm not saying that.
Right.
But if you're eating fast food for one meal, make sure your other meal is healthy. You have to.
Right.
And when age is on your side, like if you're below your 38, your metabolic rate is so high, you just keep going at it and just manage it.
Right.
Alcohol intake has to drop so that if you are giving less work to the liver, the liver is going to process your food much faster and better, So you are not going to get fat easily. It's not going to deposit anything. If you're drinking alcohol even once a week, can drop your liver function for 22 days.
Oh.
Even once a week. So the social drinking, let's not normalize it.
Achha.
It can cause obesity.
Got it.
I would just try it. Whoever drinks even once a week, or I just have one gin a week, stop even that. Watch your weight drop, which hasn't dropped, which you've been trying, that 1 kg you've been trying to lose. I have this 1 kg, I don't know why it's not dropping. Just stop alcohol for 22 days and check if you haven't, and continue your lifestyle.
Right.
Continue your exercise, continue whatever diet you were doing. Don't do anything extra, just cut out the alcohol. And after 22 days, just watch if your weight has dropped or not. You should try it.
Sugar versus, say, alcohol.
See, sugar, definitely the first thing you'll notice. Sugar versus alcohol, both should be stopped. Both should be stopped. Huh? And please don't give this bullshit of, I don't eat sugar, I eat jaggery. It's the same. Only thing plus point with jaggery is it will increase your hemoglobin level by a tiny bit. Sugar will not do even that. But otherwise, both are as bad as each other.
Achha.
Okay. So, sugar, you will see that your fogging is gone. Your mental fog. When I say mental fog, I mean, forgetting to pick up your keys. You go till the door and come back and be like, oh shit, I forgot my keys.
Okay.
That will go.
Achha.
With sugar after 18 days. Just watch. Not even 18 days. 1 week, you'll see a difference.
You'll become sharper.
You will, but the first 3 days are extremely difficult when you stop sugar. I have gone through it. And I am zero sugar, zero alcohol. My mom's going to yell at me. Not that I used to drink alcohol. Please don't tell this to my mom. So, zero sugar and zero alcohol, zero smoking. And sugar-free, I have been for the last 4-5 May, since May. So, I feel it's really helped my skin, my hair, and my fogginess has completely gone.
Wow.
I remember things which actually I was surprised that I could remember all these things.
Oh.
So, and you become sharper, your metabolic rate increases, you become much more active, you sleep better. But the first 5 days of quitting sugar was the most difficult.
Right.
Craving for ice cream was the worst. So, I would suggest everyone just quit alcohol, quit sugar, quit smoking.
Ma'am, what's considered the average or what is the right age for menstruation starting and menopause?
Okay. See, there is textbooks, again, I'm going to say. But again, you're getting your period, your first period, which is called menarche.
Menarche.
Menarche is the first period, and menopause is your last,
Right.
when you're done with periods. So menarche, previously the textbook said 12.
12.
Actually, before that was 14.
Ah.
Then 12.
Okay.
Now we see young girls as young as 8 years having their first period.
Oh my God.
It's very genetic. Okay?
Genetic.
Yes. It depends on your body weight. We see chubbier girls, young girls, I won't say fat, but chubbier girls attaining periods early because the fat cells, because of a certain enzyme called aromatase, they get converted to estrogen. The chemicals in fat, because of the fat cells, they have
Right.
this enzyme called aromatase, which converts everything into estrogen.
Right.
Right. Certain, I'm just saying this for you all to understand. When there's good high amount of estrogen, you start developing faster.
Right.
You start getting your periods earlier. So I would suggest that when they're growing up, push them a lot into sports.
Okay.
Do not, please, for God's sake, do not cut out their food. They require as much food. They are going to be so hungry when they're growing up. If they want to eat junk, let them eat junk. Let them eat what they want. Do not stop them.
Chocolates.
But whatever they're doing,
anything junk.
make sure you are equating it with their exercise, with their physical activity, and tell them, you should talk to them. If they are eating junk for one meal, make sure their next meal is a slightly healthier meal. Let's balance it out.
Okay.
See, please understand that this is not coming from a doctor's point of view, but please understand these kind of food, junk, whatever we call junk, is made for them. It's made for kids. It's not made for you and me.
Right.
It is made for their palate. It is made because they're hungry all the time.
Right.
Can you make potato chips all the time and give it to them? Please make it.
Okay.
Give them. Make it at home. If you
Right.
feel that whatever is junk, make potato chips.
Instead of packet, do it at home.
You
and
make
give
it at home. If you
Right.
have the patience to do it.
Yeah.
Because we are not able to do that. We
Hmm.
can't run a 24-hour kitchen. And they are going to stress eat. Their body is going through hormonal changes, kids. They are going to stress eat.
Right.
They will not wait for you to make it. If they feel like eating it, they will pick a packet and eat it. Let them do it.
Got it.
But
Okay.
communicate with them so that they do something better.
Understood.
Yeah,
Understood.
try to equate it out.
Yeah.
It may not work exactly like that, but at least some amount of sugar is going to come out.
So, what is the right age here? 12 years is what you mean, is it?
There's no right age.
Okay.
Frankly, there is no right age.
Right.
Even the books now, they don't say there's a right age.
Okay.
It's very genetic.
Okay.
So expect a period anytime now, present, 8 to 14.
8 to 14.
Yes, 8 to
Got it.
14 we are seeing people get. Not even 14, now it's come down to 12. 12
Okay.
we are seeing young girls,
So,
these girls
the
getting
range
periods.
is 8 years to 12 years.
12 years, right now,
Okay.
yes.
Okay.
Yeah,
This
and then
is-
menopause, again very hereditary, starts from 50 years
50
to
years.
55.
50 to 55.
Yes.
Okay.
Again, that is also very genetic.
Mm-hmm.
Yeah. Most likely, whatever age your mom or your pedama, your sister, older sister,
Yeah.
some mom's sister, got same age group, you will have it.
Acha.
Yeah, your maternal side.
Got it. Got it. So, on the what was this word that you mentioned?
Menarche.
Menarche.
Yeah.
So, menarche, does this also have any impact if people eat chicken which has got injections and all? I heard a lot about
See,
this.
they did say that, none proven by the way. These
Okay.
are studies which said adulterated food, because everything has steroids, everything has to
Huh,
look juicier,
huh,
everything
huh.
has to look bigger.
Yeah.
Steroids, it could be one of the reasons.
It could be.
Yeah, but ingested steroid,
Right.
with which it's already so chemically formulated that I don't think it gets absorbed into the human body. There are some studies which say that those steroids do not get absorbed into the body. But there are also some studies say that that could be the reason. So they are none proven, but there is a good study that says that the adulterated food is causing the weight gain.
Okay.
But haven't you eaten junk food when you were growing up?
I ate a lot.
Yeah.
I have sweet tooth.
Yeah, so did I. I think we were also physically very active.
Yeah.
We pushed out a lot of it through our sweat.
Right.
We pushed it out through our exercise, made sure our body, unknowingly, made sure our body was in a state of ketosis. How many times we've come home running with a dry mouth, a ketotic breath, and drank so much water. So
Right.
imagine the kind of exercise we did. When your body goes into ketosis, the cells will repair itself.
Yeah.
You know? So I wish we all push our kids a little. I know it's very difficult to get kids off the couch right now today, but maybe we should all figure out what sport or what activity they like, something which is going to make them physically move a lot.
Right.
You know, like
Right.
it could be aerobics, it could be dance, it could be anything,
Right.
or just jumping on the trampoline. Maybe we should just encourage kids to do that.
Got it.
So that,
Got it.
and getting menarche, getting your first period at 8 years has no side effects. You know, a skinny girl can also get it. I'm not saying that only a chubby girl will get it. It's very genetic. So I don't think we should worry too much about if a girl gets a period very early, something's going to happen. No, it's not going to happen.
Got it.
Yeah.
Got it. So let's say, couple plan sex, right? But sometimes, men force women during the period time, or I'm not sure if women also want during the period time. Is it safe to have sex
Oh
during
yeah,
period time?
absolutely. As
Okay.
long as you're keeping yourself clean, it's going to be a little messy, but then I guess it's the couple's choice.
Okay.
And men should never force somebody to have sex with them.
Right.
If the woman is going to be enjoying, and it's a couple's choice to have
Okay.
sex during periods,
Mhm.
so it's
Mhm.
absolutely fine. There's no nothing can be transferred
Yeah.
unless the lady has an HIV infection or she is a hepatitis. Then I would ask the partner, the male partner, to be a little careful. Maybe not have during that, or use condoms when you're having
Got
sexual.
it.
Even during a period, if having sex without a condom is also absolutely safe.
Understood.
If both are very healthy partners.
Understood. Understood. What's your view on masturbation, whether it is men or women? Is it safe?
Absolutely safe.
Yeah.
Again, it's a personal choice
Okay.
to masturbate.
Right.
And if it's an addiction, then you'll have to get it checked. And how do you call it an addiction, Ante?
Yeah.
You're unable to stop yourself in public.
In public.
Yeah, you're unable to stop touching yourself in public. You're doing it at work. It is hindering your work. Just like alcohol. If your work days are hindered, it's called an addiction.
Oh
if
my
you're
God.
not able to do your daily routine,
Right.
and
Right.
in between your daily routine, you're doing something in public, which is supposed to be done in private,
Right.
then it's an addiction.
Understood.
Can you get addicted to masturbation? Yes, you can. Yes, you can. We have some patients who masturbate at least 10-12 times a day.
10-12 times a
Yes,
day.
yeah, we have.
Oh my
Don't
God.
be surprised. And I don't think we should really, again, it's a personal choice.
Okay.
And we shouldn't look at it like how you said, 10-12 times a day. It happens, like an addiction. We should actually
They
look
need
at
help.
them with empathy.
They need help.
They need help. And if anything, for men or women, masturbation is absolutely normal as long as you're doing it very hygienically. Whatever instruments you're using, whatever toys you're using, make sure
Right.
they're disinfected. Make sure you are not getting some infection because of unhygienic practices.
Got it.
Yeah.
Got it. Using toys is normal, is it?
Of course,
Achha.
it is normal.
Okay. On the there's this one case that I recently read about a day back or so. In Karnataka, some 9 years old or 9th class old kid, she delivered a baby in her school's toilet.
Yes.
Reading that, it was very unfortunate, but I'm surprised. Why is that even teachers or parents didn't even notice bump on the kid or whatever?
You are talking about this now. I heard this the first time when I was a child. I was probably 10 or 12 when my hospital, my mom was counseling somebody.
Okay.
And home housekeeping staff, she came crying, and she brought her daughter.
Okay.
And who complained of pain abdomen. Young girl, hardly 16 or something.
Mhm.
And she was just a chubby child.
Okay.
Not like she looked like she was pregnant or anything. At least
Ah.
that's what my mom said. She was always a big child, you know. And she went into the bathroom. She delivered a child in the bathroom. The mother didn't know. The housekeeping staff. Imagine, this housekeeping staff has been working in our hospital in a maternity setup. Couldn't pick up her daughter being pregnant.
Whoa.
And was never brought to the hospital. Imagine the agony the child went through for 9 months.
Oh my
Just
God.
imagine what we are all talking about, that one incident where she delivered. Imagine how much that 9-year-old child would have gone through every single day, every single hour for 9 months. We can't handle one day stress before an exam. Imagine she was handling the kind of stress for 9 months, and what measures she would have taken as a 9-year-old child to cover the bump. She would have felt like such an outcast,
Yeah.
and nobody was there to help her out because she couldn't reach out to anybody. Just imagine the agony she went through.
Yeah.
You think any 9-year-old will want to get pregnant and give birth? She probably didn't even know what was happening.
Right. Yeah.
And you know, she would have read some nonsense on YouTube. She wouldn't have even known what was going on. You think she knows what full dilatation is, what delivery is? She wouldn't have even known what periods were, to begin with. You know?
Honestly, I was next to my wife when she was delivering for both the kids.
Yeah.
And first time when we had a kid, the kind of pain that she went through,
Yes.
we said, yeah, one is enough. Okay. She also said one is enough. I'm not gonna give birth for another. I was having tears in my eyes when I was
I
looking
know,
at the
it
pain.
is, yes.
Right? Insane pain. Second, after we took solid gap. In fact, what is the right gap?
Nothing like that. Anytime after, see, you can have back-to-back.
I'll ask this afterwards.
Yeah,
I'll just finish off
yeah.
this, right? Second kid, after some time, she said, let's have one more. And that's when we decided we'll go for one more. Second time also, during the pain, it was insane.
It is,
Again,
yes.
I was like in tears.
Yeah.
Oh my God.
So imagine what, you know, and like I always say, a mother can hold in so much pain and will still do it for another life.
Right.
You know?
Right.
So, like I say, the pain is unbearable. It's, imagine a 9-year-old taking
Alone
that
in
kind
bathroom.
of pain, not knowing. Imagine how we failed as a society to be there for them. We have failed miserably as a society.
Yeah.
And it's sad that she had nobody to talk to. She had nobody to go through with it.
Yeah.
So I think that is something we should introspect. Not that she got pregnant and delivered. Imagine how we should introspect as a society that we failed her.
Yeah.
We failed her and we failed miserably. I think we should introspect, not think about her, how she got pregnant. You know, yes, who got her pregnant should be whacked also.
Absolutely.
Yes, should be whacked.
No mercy there.
But how we failed her as a society is something we should really think of. I think we have failed miserably as a society. In her eyes, we've completely failed. I don't think any of us can ever look in her eye. As a society, we cannot.
So since we spoke about this child's case, I want to ask, when is the right time to educate teens and children, especially on the sex side of it?
Yeah. See, let's take this young girl, for instance.
Yeah.
You know, sex education shouldn't be just about sex.
Okay.
It should start at a very young age, where we start teaching them about bad touch.
Yeah.
If this young girl was really, it penetrated into her head that, you know, bad touch is this, good touch is this.
Yeah.
Do not tell somebody, let somebody tell you, keep a secret from your close ones.
Right.
Keep a secret from your parents. Keep a secret from so and so.
Yeah.
And okkasari cheppi, you can't just leave it.
Yeah.
You know, they're kids.
Right.
We itself need, you know, being told every now and then, you know. Kids should be told every now, both men and women. In today, there is no difference between a boy being sexually abused or a girl being sexually abused.
Right.
Both boys and girls are equally sexually abused. If you've seen the statistics, we have to keep retracing and teach the boys not to touch the women and teach the girls not to be very careful.
Yeah.
Be careful as in vigilant.
Right.
I'm not saying be careful as in sit at home. No, this world is meant for both men and women.
Absolutely.
You can't sit at home. You can't tell the girl, don't go out in the night. It's
Right.
very wrong.
Right.
Teach them to be vigilant. Teach
Yeah.
them how to handle a situation.
Right.
Okay. And teach your boys. All of us should teach
Yeah.
the boys not to let such situation come for the women.
Right.
I think we are not teaching the right sector the right things.
Yeah.
We are telling the girls, be careful, sit at home. We are not telling them to go out and handle the situation.
Right.
And it should start very young as maybe once they understand what you're saying, which could be 4 years, which could be 5 years, teach them good touch, bad touch.
Right.
This is also part of sex education.
Yeah.
And then they slowly move on.
Right.
And then each age you have to teach them. When they come into their teens, they are going to be wanting to explore their sexuality. But you tell them to hold your horses.
Right.
Your body is still growing. See, in India, what is the legal age? It's 21.
Right.
Okay, so wait till you're 21,
Yeah.
and then you have your sexual act. There is a reason why, because mentally you're stable, your body is almost done growing,
Yeah.
there's no hormone, because sex is going to cause hormone changes.
Right.
So let it come naturally. Do not start it with sexual act.
Yeah.
And you have any doubts, talk to somebody. There are
Yeah.
counselors that I am there. Just
Yeah.
call. I am willing to talk.
Right.
I am willing to tell you, that what age to have sex, what are the chances of having side effects having sex at a young age,
Right.
and how to avoid having sex. Don't do it under peer pressure. 90% of young girls do it under peer pressure.
Yeah.
Even boys.
Right.
90% of young boys do it under
Yeah.
peer pressure. No one talks about what a boy goes through, when they have sex just to show off. They might not like it. They are doing it for peer pressure too. Oh, my friend, this boy had sex. I also want to have sex. They might not be interested. Oh, you didn't have sex till now. You are a virgin. We've heard that among guys. Yeah?
Yeah.
So they might have it with some random person they are not even interested in. They might feel bad too, Just the way a woman feels dirty after doing it with somebody she's not interested in, they might feel dirty too. And I think this is something we should talk to our boys also.
Got it.
Yeah. And 21, you're mentally also a little grown, men and women. And 21 should be the age to wait and have sexual activity, legally at least.
Got it. So let's assume, somebody had sex in their teens and they got pregnant, and they usually either go for abortion or they go for contraceptive pills.
Correct.
Mostly contraceptive pills. Now, how safe is this contraceptive pills?
See, everything like, contraceptive pills. We are talking about the emergency contraceptive pill that people use within 72 hours of having unprotected sex. See, contraceptive pill cannot be used as a regular contraception. This emergency pill, you can't use it like a regular, eppudu chesna taking off a pill and all, doesn't work like that. Assalu, you should not take it like that. It shouldn't, actually you should limit its usage. It has major side effects to a point where you can never get pregnant again. It can cause major side effects. It can cause ectopic pregnancies, which may go undetected and can make you lose your life also.
Ectopic pregnancy, if you can
Ectopic
elaborate.
pregnancy ante any pregnancy that happens outside of the uterus. Except in the uterus, it can come anywhere. It can come in the tube. Adi burst out there, they won't even know.
Risky.
Because they might get a little period before that. They'll assume I'm not pregnant, and it'll just burst and you'll have an internal bleeding and you may lose your life.
Okay.
So I would suggest wait till your legal age to even use contraceptive pills.
Okay.
You're sexually active, you should meet your gynecologist. The girl, I'm talking about the woman.
Yeah.
You should meet your gynecologist and you should take measures.
Right.
For you. Each person will have a different type of a body.
Okay.
See, thyroid unte, we give you a different type of contraceptive pill so that you don't have side effects.
Right.
Polycystic ovaries unte, we give you a different type of contraceptive pill so that again you don't have side effects.
Okay.
Idi veelki ichchamankonde, they'll have major side effects. They'll start gaining weight. They'll get acne. So you have to meet your gynecologist, get the proper contraceptive pill,
Understood.
which will also help you in your in having a healthy lifestyle.
Okay.
And if you want to still go, inka careful ga undali ante condoms, so that you don't get STDs also.
Yeah.
Avoid having multiple sexual partners if you do not want to have sexually transmitted diseases.
Right.
And make sure your partner also doesn't have multiple sexual partners. That's very important.
Very important.
Very
Yeah.
important.
Yeah.
And getting pregnant, please, again, this is something I tell everybody, unmarried people, don't go to quacks, don't get scared, and don't buy some medicines from some stupid medical store and take medicines on your own to abort. You get these MTP kits and all. There is a certain way of taking them. Listen, you'll go, a lot of young girls come to me and say, ma'am, I'm having continuous bleeding because I just took the MTP kit. I said, who told you to take it? Medical shop guy. He's not a doctor.
What happens with the MTP kit?
MTP ante medical termination kit. Okay. Okay. దాంతో ఏంటంటే అబార్షన్ అవుతుంది అనమాట. For that there is a process. You have to do a scan. You have to see the some number of weeks. If it is a certain number of weeks only, you can take the tablets. చాలా మంది they don't even do the scan. Directly they'll just go భయం వేసేసి తీసుకుంటారు. Don't get scared. Come. We will legally, if you've taken something, come to a doctor. We will counsel you. We will see what can be done.
Right.
If you've used some contraception, it didn't work, it's okay. We will see what can be done.
Yeah.
Okay, but don't just take some pills because somebody in the pharmacy told you. Probably he's not even half as educated as you.
Yeah.
Don't ruin your uterus because you're under stress. Leave the stress to us. We'll take care of it.
Yeah.
You just show up. Don't get scared. And lot of young girls, they get scared ki amma they'll scold us, tirtaru. We are not here to judge you.
Right.
And if somebody is scolding you, stop going to that gynecologist. Please stop. They don't deserve to be treating you.
Right.
Okay? Come. None of us are here to scold. None of us are here to judge. We are here to help you out.
Right.
We studied so much only to improve your quality of life. So we are here to help you.
On the men's side, men also, kind of go out and buy things randomly, thinking this will help me increase my sexual stamina or increase the size of my, penis, etc. Is this right? Do you think it helps?
See, always wanting to be better.
Yeah.
In your mind, something you think is going to make you better is nothing wrong.
Okay.
But taking the right treatment is the right way to go ahead.
Okay.
You want to do something, you want to increase your stamina. There are certain medicines, like for example, sildenafil, which is also known as Viagra.
Okay.
These kind of medicines, don't take it just like that.
Hmm.
Will you take some medicines without a doctor's consent?
No.
Like say antibiotics and all?
No.
For an antibiotic, you're going to a doctor. Why can't you go to your doctor to take a Viagra also? Just take their advice. And now online also there are available doctors.
Yeah.
It's a press of a call. You just call, you fix an online appointment. Even if you're so shy to meet them in person, doctors are available. We're all available online.
Right.
We have set timings. We have emergency calls. Call us. We'll ask you a few questions. Like, do you have BP? Are you taking any medication? We have seen patients coming to the ER, emergency room, who've taken Viagra and collapsed.
Ah.
Okay. Because they don't realize when you're a hypertensive or with high BP, you can't take Viagra.
Okay.
Don't try to be a hero. Okay. Heroism is not just in bed. Okay. It can be shown in other ways also. But you want to take Viagra? Take proper medical advice.
Right. Right.
And then take. There's no harm in taking.
Right.
Even the woman is happy if you've taken Viagra, you're able to perform better. Everyone's happy. Okay.
Right.
But taking medicines without advice, these are chemicals you're putting into your body. First, find out if your body can handle those.
Yeah.
Anyway, nobody's taking advice from doctors for drinking or smoking. At least this you take advice. It will really help.
Right.
And there are different types of medication to increase your stamina in bed, in sexual act, for different type of health issues.
Right.
Like BP unna, there are certain medication for high blood pressure people to increase their stamina.
Okay.
So take the right kind of medication.
Got it.
Not
Got it.
everybody should take Viagra only. There are medications for different types also.
Right. In one of the videos I've seen where you spoke about, young girls who are sexually active, just before they're getting married, they come to you for a tightening of their
Yes.
vagina. Is this very normal?
Yeah.
Yeah.
Just before marriage, they go for facials also, no? If they can do that, they can do this also. And there's nothing wrong.
Yeah. Okay.
If you want to do something to which is going to add to your life, but there's nothing wrong in doing that. If you want your whole body to look a certain way, there's nothing wrong. We are
Right.
promoting so much, everybody is going through plastic surgeries nowadays. They look completely different than what they were. So if you want to tighten your vagina, it could be for various reasons. Please
Right.
don't assume that a woman is coming to get her vagina tightened only because she's had sex. It could
could
be
be
to
other reasons
beautify
also.
also.
Okay.
She might have a certain idea of a beautiful private part. And she might come to us and say, I want it to look like this. I want it to be the same color as my thighs. I don't want it to be darker. I don't want it to be lighter. I don't want it to be so thicker. I don't want it to be a certain way. We will correct it for you if it is possible.
Right.
But don't come to us with a total different idea, which we cannot do. Whatever we can do, we will do.
Got
And
it.
some people come to us even after 2 births, 2 vaginal deliveries. They come to us to tighten because
Right.
she or her partner are not having the sexual pleasure.
Right.
So then we tighten. If that is going to improve their sexual activity, why not?
Got it. Got it.
It's only
Got
going
it.
to improve their quality of life.
Right. So it's quite normal, and
We should
You do
normalize it. Even if it is not, I think we should
Yeah.
normalize it.
got it.
There's
Got
no
it.
harm.
What is the ideal gap between the two children that a couple plans?
See, normal delivery out there, immediately you can plan a pregnancy.
Okay.
We've seen kids,
Yeah.
one after the other every
Correct.
year. There's no harm.
Okay.
As long as the mother's hemoglobin level is good, her BP, everything is good, she feels she's well recovered, you can immediately plan a pregnancy.
Okay.
We normally say wait for 6 months after a normal delivery, however you feel. We
Okay.
have patients who come immediately also. Within 3 to 4 months, they come. We have patients, but if it is a cesarean, I tell them, wait for 18 months
Okay.
for the next child.
Right.
Because your uterus needs to become stronger
Okay.
from a little cut that we have put on the uterus after a cesarean, so that cesarean scar is good, healed, so that we can give you maybe a trial for a normal delivery in the second pregnancy.
Okay.
Yeah.
Okay. Got it.
But then again, giving a gap is again a couple's choice. Yeah, it's a couple's choice.
Yeah. It's very different in a lot of people around me itself. We thought we'll stop at 1, and we planned second quite after some time.
Right.
So there's a friend of mine who immediately did within 2 years gap.
Yeah.
I think it's very different.
Oh,
for
I
each of
have
them.
some patients who I would deliver them, assuming that they're coming for a checkup, a regular checkup after 3-4 months, and they're like, ma'am, I'm pregnant again. I'm like, I'm
Yeah.
happy for you, but let me check if your hemoglobin levels are good.
Right. Right.
I am actually very happy that they are ready and strong to take on another delivery.
Right.
I think you should salute such couples and
Yeah.
salute the women actually.
Yeah.
And see, they wouldn't be so happy and take on it, because we see and we can tell, if the couple is not a strong couple.
Yeah.
When they're strong and they're ready to take on a next child immediately, why not? And if she is healthy, she should, if she
Yeah.
wants to.
Yeah. In fact, respect to women, when you mention especially women, respect to them, because after going through such a huge pain,
Yes.
again carrying once again immediately
Oh,
without
yes.
gap is
And
a
then-
challenge, I feel.
But then, Pradeep, I'll tell you something. We have this mindset. I think it happens only in India. Okay. తొందర కనేయండి ఓ పని అయిపోతుంది.
Yeah.
I've heard this through so many people, తొందర కనేసేయండి
Immediately,
అయిపోతుంది, ఒక పని అయిపోతుంది. Hey, how is it funny, man? I don't understand. Let them have. We are also young now. We also can take care of your children. I've heard mothers and mother-in-laws, father-in-laws, fathers saying, we are also young. Malli main chuskogaltamo ledo. It's okay.
Right.
Let the couple handle it. Let them take a decision, that mindset of time. Appa, 1 year poyindi, adi. I'm like, what is there? If 1 year is gone, you'll do it next year. That is something I never understood,
Right.
in today's day and age where life expectancy has gone up so much. You're
Yeah.
still worried about some 1 year. Even my dad, my God, I remember when I was studying MSET, he's like, one chance, you have to do. I'm like, Dad, if I don't do it this time, I'll do it next MSET. He's like, no, one chance only. So luckily, I got through it. Thank God. But then that no wasting time, no waste. I said, what for?
Right.
I'm wasting so much time now, no?
Yeah. So on the normal delivery versus C-section, while most couples want normal, we often see some of the hospitals, not all hospitals, some of the hospitals try pushing for C-section. What's your point of view on this?
See, I'll tell you. See, in Telangana now, okay, if you go to any hospital, there is no package for normal, there's no package for cesarean.
Okay.
There is only delivery package.
Oh.
There are no more. Most 90% hospitals, private hospitals, they say, Amma, delivery normal aina cesarean ai, ide package.
Got it, okay.
Okappudu, cesareans were highly charged because of the disposables we used. Anesthesia effect undedi, charges undevi, then operation theatre, anesthetist ki iyali, so many.
Right.
That's why it was more expensive. Now, there's no difference. Normal delivery, you get an epidural. That is charged more than your spinal anesthesia. They both are being conducted in, sterile conditions. Everything is the same now. So, we have to understand that, one, nobody wants to do a cesarean.
Okay.
Trust me.
Yeah.
We gynecs would prefer a normal delivery.
Okay.
Because utti maa chetullone undadi. They call us, we go, we deliver. If it is a cesarean, you know how much work we have to do. We have to make sure the anesthetist is on time. We have to make sure the pediatrician is there. We have to make sure it's done on time. We have to make sure the theatre is sterilized, everything. It's so much work. If it's a normal delivery, they call us, we go, patient is in labor, we go.
Okay.
We deliver the patient. And if you think, if people think that normal is much cheaper, it's not.
Okay.
Normal and cesarean are charged the same. Normal or cesarean, the number of days of stay in the hospital are the same. Probably cesarean, they just stay an extra 12 hours. That's all.
I think now, I disagree here. So, when you speak of tier 1 cities, where you have all the facilities and certain grade of hospitals, say multi-speciality, which are tier 1 in category in the hospitals.
Tertiary sector.
There, I think what you're saying holds true. But beneath that, I don't think it's the same. At least that's what I have seen in terms of market. There is different package for C-section versus normal.
No, not anymore.
No?
See, no, not anymore.
Okay.
In Telangana, not anymore.
Acha.
And normal delivery or cesarean, now there are no normal delivery cesarean. Maximum there would be is 1,000 or 2,000 extra.
Okay.
For that extra 12 hours or something, they must be charging. Whatever that extra room rent. If you're taking some high-end room rent, it's going to be a little more. 10,000 per room and all that. That's a choice again. But I don't think so.
Okay.
See, I do deliveries in secondary setups, tertiary care also. I do primary health centers, of course. I don't go there because they already have enough doctors there.
Right.
And I have conducted deliveries in my friends' little nursing homes.
Okay.
We had a nursing home which has then become a hospital. So we never had any difference.
Okay.
I think maybe because it came from a line of doctors, we never wanted to charge separately for normal or cesarean because some people go for muhurtam deliveries because we know the normal avvadu. We know certain cases that the position is not correct. You will not have a normal delivery.
Okay.
Or the patient is highly diabetic, highly hypertensive, or in certain other conditions where we
Right.
cannot let them put pressure on their heart with contractions. There are certain heart conditions and all that. In such cases, when we know it is cesarean only, people, we
Risk
are
cases we
Indians.
understand.
Yeah,
Risk cases
these
we
are
understand.
Indian. We are Indians, so we have a lot of muhurtam cesareans.
Yeah.
You know?
Oh, okay.
So that also, some people,
so people
want
say I want at this
muhurtam,
time,
yeah.
this day
But
particularly.
not many doctors encourage it. We
Okay.
don't encourage it.
Okay.
At least I would love to accept and assume that none of us encourage those kind of unwanted cesareans.
Yeah.
I don't think we would
Possibility
like to do.
of normal is
Yes.
there,
And
but then
yes, we will
because
give
of
a
that-
try for normal. And if it doesn't happen, then we'll go for section.
okay.
But because you want it at a muhurtam, you want me to do cesarean, that's wrong. That I don't think doctors do that.
Okay.
Yeah.
Okay. Now I get it. There are doctors who must be doing it then.
Maybe. I don't know any of those doctors. At least they are not my friends.
I think let's move to the myths now. There is this facial, PRP facial or something like that, sperm facial or whatever they call it, right? I wanted to understand, is this a myth or is this real?
Oh no, come on. It's just nonsense and rubbish. I've said this in another podcast also. Please don't do nonsense by taking sperm and putting it on your face. You'll end up with acne and some skin rashes, and you will attract only people who want sperms. You will not attract anybody else.
There is another myth where, not breastfeeding or certain type of bras will cause cancer, breast cancer. To what extent it is true?
See, no bras can cause breast cancer unless these bras are made up of some radiation equipment or with radium or something. But bras, underwired, non-underwired, sports bras, none of them cause cancer.
Okay.
Cancer breast is caused by a mutation in a gene,
Ah.
which a bra cannot do. Bra doesn't have so much capacity to go into your gene and mutate it.
Okay.
It's not possible.
Right.
Your lingerie cannot do that. Anta
Okay.
power ledu women lingerie ki.
Okay.
So getting cancer because of a brazier is silly. We shouldn't even think in those terms.
Got it.
Unless your bras are made out of radium or radiation equipment.
Does oral sex cause cancer?
No. No, it doesn't cause any cancer. But be very careful when you're having oral sex. If the other person may have herpes simplex or some STD, it can transfer to you.
Got it.
Yeah.
Got it.
Any
Got
kind
it.
of STD can transfer.
Got it. Some people speak about not shaving at the private parts. Some people prefer shaving at the private parts. Is it right, wrong? What is your take?
Again, it's a personal choice.
Okay.
If you're going to wear a underwear like your lingerie regularly, you're going to wear cotton lingerie, very healthy looking, healthy fabrics and all. I don't see a point in having hair.
Okay.
Hair is meant to be a protective mechanism. Back in the day when they were, at least this is my take on it, having a lot of hair on your private parts, not removing it or trimming it or letting it grow, if you're having hair, it can catch a lot of infections in it if you are not keeping it thoroughly clean.
Okay.
You have to wash yourself, just like how you take care of hair on the rest of your body, like your head. You have to make sure.
Understood.
If it becomes cumbersome and you're not able to, because hair will hold on to sweat will hold on to certain bacteria, which can go into your vagina and cause infections.
Got it.
So if you want to avoid it, take away the hair. But again, it is a personal choice. If you're going to have a healthy lifestyle, like, healthily, you're going to keep your body really healthy, wash it twice daily, make sure you change your undergarments regularly. I don't think it should be a problem to have hair or not have hair.
Got it.
But this is something I'd like to tell. Private parts should be washed with an intimate wash at least once a day.
Okay.
And with just hot water is not enough. Just like how we use brush with toothpaste in our mouth, we should make sure, I'm not saying inside the vagina, but outside, you have to wash yourself with soap, like I'm talking about a bar soap, not body wash, or you use an intimate wash and wash your private parts at least once a day.
Understood.
Yeah.
So, doctor, last question for the podcast. If you have to give advice to the women, what is that advice that you would want to give to women who are watching this podcast?
From a very gynec standpoint, do not assume anything. Don't treat yourself if you do not have a medical degree. Whatever it is, it might be scary, it might be silly according to you, it might be stupid, it's okay. Simple things like, can I even wax? Absolutely fine. Just come to us. Don't do it and then come. Don't treat your body like a mechanic shop where, like you've done it and then you've gone to fix it. Please come. We are always there to clear any kind of doubts. We studied for 10 years for this only. So don't worry, you just come to us. But if you want me to tell as a woman in her 40s, after experiencing things and being on my own financially, like how you spoke and all that, the world is here at your feet. Just do what you please. No one should tell you do this, do that. And everything, there is no right or wrong. According to me, there is no right or wrong. As long as you're not hurting another person, I think just go get it. The world is at your feet.
Okay. Thank you, doctor. Thanks for coming onto the show.
Yeah.
It was really wonderful. I was a little scared if I will be able to ask all the questions that I was thinking of, but the way you responded actually helped me ask you the questions.
I'm glad. For somebody who said he's very shy, he asked quite a few bold questions.
Thanks for the time, Dr.
Anytime, Pradeep.
So, if somebody wants to reach, because looking at some of the previous comments on the other podcasts, people keep wanting to reach out to the guest, right? If they want to reach out to you, how do they reach out?
You know what? We can give you a number.
Sure.
Where they can contact us on that number, and my team will put them through to me.
Sure.
Yeah. So I will pass on the number to him and he'll leave it in the description.
Perfect. Yeah. Thank you, doctor.
Super. Bye.
Thank you for watching this episode till then. If you found this episode valuable, please hit the like button, share your thoughts in the comment section, and don't forget to subscribe to the channel. It helps us bring more such content to you. And if this conversation resonates with you, share it with your friends and family. Someone out there might really need to hear this.